Hello everyone, welcome to our live lesson for today. I can see that we have quite a few people joining us, so we'll just wait a second for those people to come and join us. Welcome to our session for today. Come and say hi to all of the other attendees in the chat box. I can see we have got Ilona who started the chat for us today, which is great. Thank you very much, Ilona. So come in and say hi in the chat box. And before we start today, I'm interested to know when do you have your exam coming up? So do you have your exam coming up soon? Have you booked an exam? What is your situation with your OET exam? Okay, great. Okay. All right. Great. So we've got a few of you who have the exam coming up very soon, which is great. So good luck for those who have got the exam coming up soon, and those who are still preparing, which is great, and those who are planning a little bit later this year. Okay, so I am Bethan Edwards. I am the Academic Director here at Specialist Language Courses. And today we're going to talk about OET Speaking. We're going to look at common verbs that you can see in the OET Speaking. And we're also going to look at useful language and useful phrases. So before we start, just a few tips for our session. It is going to be recorded, but feel free to take notes, take screenshots, but just know that we're recording it and we'll put it onto our YouTube channel a bit later. And you can also go to our YouTube channel and find lots of other free tips and videos and all sorts of advice to help you prepare for your OET exam. Just a little bit about how we're using Zoom today. So we're using the chat box to complete tasks during the class. So I will ask you to write ideas or answers into the chat box. We'll be using polls. So in order to answer a poll question, click on the answer that you want to choose and then click submit. And then we'll talk through and analyze those answers. And then we also have the question and answer function. So please put any questions you have in the question and answer function, and we will do our best to answer them at the end of our session when we'll have time for questions and answers. And third, don't forget to register for our next free live lesson, which is on Thursday, when Jo will be looking at the OET writing and she'll be focusing on the assessment criteria. Okay, let's get started. So today we're going to particularly look at some of the common verbs you might come across in the OET Speaking. We are going to look at picking out imperative verbs on the roll cards and give you some tips for this. And then we're going to look at some of the language that you can use for those verbs and those functions. So I'm going to start off with a question. So for those of you who have started your OET preparation, what are some of the verbs that are commonly used on the OET roll card? So for example, we're thinking of the imperative verbs like find out. So what other verbs can you often see on the OET roll card? Write your answers into the chat now, please. Great. So we've got some ideas coming in here. So we've got quite a few of you writing explain. Great. Yes, that comes up a lot. Explain, reassure, emphasize. We have describe, ask perhaps as well. Yes. Advise. Good. Explore. That one comes up sometimes as well. And recommend. Good. So let's take a look at some of those verbs that often come up in the OET exam. And let's compare your ideas with the ideas we've got here. So some common verbs that recur in all sorts of different situations on roll cards. You have find out, where we need to ask questions. We have explain, you may need to explain medication, treatment, or a particular course of action. Empathize, so this is something you need to do throughout each role play. Reassure if you have an anxious patient. Advise, as quite a lot of you have mentioned. Encourage if you have a reluctant patient. Persuade, you may see persuade or stress the importance of a particular course of action. So if you have a reluctant patient, you might need to stress the importance of taking their medication. And we might also have reinforce as well. So it's really good when you're doing your OET preparation to be aware of these common verbs, understand what they mean, and have a bank of phrases to use to express each of these verbs. So something else that's important for you to know is where you can find these verbs on the roll card. So the more familiar you are with the format of the exam, the lower your stress levels should be on the exam, and you can really focus on communicating with the patient you're talking to. So on an OET roll card, you will always have the setting. This tells you where you are. You're an accident emergency or a clinic, for example. You will have information about the patient. So the patient or the carer, in this case, as you're talking to the mother of a child, and this also has information about their condition or perhaps the reason that they've come to see you. And then you have the task. And under the task, you will have bullet points, and you will have a variety of verbs here to give you instructions on how you need to manage the role play. So let's take a look at that a bit more closely. So we're going to focus on these verbs today. So we're going to look at find out. So here we need to find out about the current skin problem. So we need to ask a question. We need to explain the importance of using a moisturizing cream. So we're giving an explanation as to why this is important. Here we need to reinforce the occasional need for steroid cream. Now, something to watch out for in your OET task card are clues as to how is the patient feeling. So if you have a verb like reinforce the need for, this suggests that possibly the patient knows that steroid cream is necessary, but perhaps they're a little bit reluctant or resistant to using it. So you can tell a little bit about how the patient might react. So you perhaps need to explain again and reinforce why it's so important. And then we have give advice. So we have to look at different phrases that we can use for giving advice on how to manage eczema. Now notice that you have some words in brackets here. You will often see words in brackets, and this is giving us an example of how you can manage eczema. So you can use these ideas when you're speaking. So what we're going to do is we're going to look at some phrases that we can use to express these different verbs. So on the screen, you can see A to G. So we have a variety of different phrases here. And these phrases can be used to express the imperative verbs that we have just seen. So we're going to use the chat box. I'd like you to, I'm going to show you each of the function verbs, the imperative verbs, and I'd like you to write into the chat box, which phrase do you think expresses this? So we have number one is find out. So in the chat box, you can write one and then whichever of these phrases is best used to find out. So for example, maybe 1A or 1B. What do you think? Okay, great. So it's all quite unanimous in the chat there. So a lot of people saying E for that one. Could you tell me? Okay, let's look at the next one. The next one is explain. Now, remember, we're explaining the importance, and it's explaining the importance of using the moisturizing cream. So what can we use for number 2? Remember to write the number as well. So 2 and whatever letter you think. Okay, so we've got a variety of answers here. Now let's look at the next one. So for number 2, we've got explain the importance, and then number 3, we've got reinforce the need. So remember, perhaps the patient doesn't really want to use steroid cream, so you need to reinforce that it's important. So what can you use for 3? Okay, let's look at the last one. The last one is give advice. So in this role play, we're giving advice on managing eczema. So there is more than one phrase for number 4. Okay, let's have a look at those phrases, and then let's have a look at the differences between the phrases. So for find out, which you are all spot on and got correct in the chat, could you tell me? So we're using an indirect question, we're using a polite question. Could you tell me more about your current skin problem? For number 2, we have explaining the importance of. So a phrase we can use here is there are some things you can do to help. So we're using the explaining the importance of using a moisturizing cream. There are some things you can do to help, for example, using a moisturizing cream. Now, the difference between 3 and 4 is interesting. So we have reinforce, which suggests that you need to give some use some quite strong language here. Perhaps it's something that the patient doesn't want to do, but is necessary. So we're using it's essential that you, and it's very important. So the steroid cream has been prescribed, perhaps the mother doesn't want to use it, or the child doesn't want to use it, and you have to reinforce that it's very important. So we have some strong language here to reinforce. And then to give advice, we have it's a good idea to, you should, and I recommend that. So again, we're giving advice, and perhaps in this particular role card, the advice is not quite as strong as reinforcing a particular point. Therefore, we have stronger language here for reinforcing. So let's look at how this can be used in the context of this particular task. So when you're preparing for OET, it's a good idea to have some phrases and then practice using them in different contexts and different settings. So for find out, we could ask, could you tell me how you normally look after your daughter's eczema? So this is quite a specific question. And you may need to start with, could you tell me about your daughter's skin condition at the moment? So we start with a more general question and then ask more specific questions to find out more information. If we're explaining the importance, we might need to say, it's very important, or it's important that you use moisturizing cream twice a day to prevent her skin becoming too dry. So we're giving a reason as well. We're explaining that it's important and why. Reinforce. Now, remember I mentioned that perhaps the patient or the carer is reluctant or resistant. So here we can see that the mother has expressed that she's a bit anxious. So you should always make sure that you acknowledge that the patient is perhaps a bit worried and acknowledge that you've understood. So I know you are worried about hydrocortisone cream, but it's essential that you spread a thin layer on her skin when it's really inflamed. And then we have giving advice. So it's a good idea to cut down on the number of baths and to be careful not to use any perfumed soap. So you need to develop and build up a bank of phrases that you can use to express each of these different verbs and imperative verbs. This will help you to manage the role play, to respond to the patient, but also it links directly to the assessment criteria. So when you're assessed in your OET role play, you are assessed on a variety of different clinical communication skills, one of which is information gathering. So we can see that find out links directly back to information gathering. And if we look at this more closely, we have some assessment criteria on how you should be gathering information. So you need to make sure you use open questions. Could you tell me more about your daughter's skin? And then move more to closed questions. How long has it been going on? Does she have flare-ups at the moment? Also, our advice here is not to use compound questions, so not lots of questions in one. And also, it's good practice for you to clarify any statements or summarize any information. It also links to information giving. So when you're explaining or when you're giving advice, when you're reinforcing, you are giving information. So you need to make sure that you do this in a clear, methodical way by using pauses and encouraging the patient to contribute and making sure that you check the patient has understood. Now, something to note here, when you're giving an explanation or when you're giving information, you need to check what the patient already knows. So for example, you might ask a patient, what do you know about using a moisturizing cream? Listen to your patient's or carer's response and then go on to your explanation to make sure that you are giving clear explanations. So we looked briefly at some phrases for reinforcing and for giving advice. Something else that is really important is to make sure you use the right level of advice and the right strength of advice. Sometimes you may need to give strong advice, as we've just seen with reinforce. Other times your advice may not need to be so strong. And it's important that you know the difference in the different phrases for these. So we have 3 sentences on the screen, and those 3 sentences are on the screen. And what we're going to do is I'd like you to look at those sentences, 1, 2, and 3, and then decide if the phrase that's used is more of a suggestion, advice, or strong advice. And I'm going to do this in a poll. So I'm going to launch the poll now. Okay, you should be able to see that on your screen now. So I'd like you to read the 3 questions and then decide for each one, is it suggestion, advice, or strong advice? Okay, great. I can see that you're answering the polls now. That's great. Okay, so look particularly specifically at the phrases that are used at the beginning of those sentences. Okay, good. Great. So I can see that you're still voting. Good. Okay. Great. Okay, so I am going to end the poll now and let's have a look at those results. So we can see that for question number 3, most people are in agreement that 92% of you feel that this is strong advice. But then questions 1 and 2, it's about even on whether they're suggestion or advice. So let's have a look at our recommendation here. So for number 1, it is more of a suggestion. We have got this hedging language here. It might be a good idea. It's more of a weak form of advice. It might be a good idea. So this is suggesting that perhaps this course of action is something that the patient could do, but is not particularly essential, but perhaps is a good idea. So we've got, it might be a good idea for a suggestion. We have then got slightly stronger advice, which is suggesting that it's important that your patient does this and they need to make quite an effort. So we've got try to, cut down, and then we've got strong advice, as we've seen in the previous role card, that it's strong advice, that it's important that the patient follows this advice. So we've got strong advice here. It's crucial that. However, as many of you identified, sometimes suggestions and advice and knowing the difference between them is a little bit tricky. But just notice the language and the verbs we've got here. So might suggest that it's less strong in terms of advice. So when you are giving advice, make sure you're aware of phrases for the different levels of advice. So we've got some phrases for suggestion. So it might be a good idea to, it would be better to, I suggest you try to, or why don't you, all phrases that we can use for suggestions. We also have phrases for advice. So you can use imperatives. Try to cut down, eat more green leafy vegetables, for example. It's a good idea to, you should, and I recommend are also phrases you can use for advice. Then for strong advice, perhaps if we're talking about a course of action that it's necessary for the patient to take, it's very important, it's essential, it's vital, and it's crucial that you. So make sure that you're aware of these different phrases and the different levels of advice. So some study tips. If you are preparing for OET, we have some great ideas for you to help improve. So make sure you watch videos of an OET speaking test. There are plenty available on the OET website, so you have a clear idea of what's going to happen in your OET speaking test. So there's nothing unexpected. Write down useful phrases in your notebook. Make sure you revisit and reuse these phrases regularly. It's not enough just to write the phrases down and then leave your notebook. Make sure you revisit, reuse the phrases. Perhaps you can make flashcards with these phrases on so that you're seeing them regularly and you're practicing using them. And one of the aims in your OET speaking is to increase your flexibility. So try to use a variety of phrases for one function. As we've seen, advice, you have got different levels of advice and you've got different phrases you can choose. For example, when you need to show empathy, instead of always using the same phrase, I understand, try to use a variety. So we've got, I can see that you're worried. I know it won't be easy. So try to use a variety of phrases so that you can respond to patients as naturally as possible in your OET role play. So in terms of verbs and phrases, make sure that in your OET exam in the preparation time, make sure you focus on the imperative verbs and make sure that you are aware of suitable phrases for each verb, and then practice using these verbs regularly so that you can use them naturally and you can use them fluently in your exam. Okay, so time for questions. So we can use the question and answer function to ask any questions that you have about speaking. So I can see we have a question here already, which is great. So our question is, when we are greeting the patient initially, is just saying hello enough, or do we have to ask about how they are feeling? So this is an excellent question. Now, when you start your OET role play, you need to make sure that you say hello and you introduce yourself in an appropriate way. So you might start with saying, hello, my name is Bethan. I am the doctor on duty here today. Then, depending on the situation, depending on the setting, will then guide you as to how you start the conversation. So you might start with what brings you here today, or you might say, I can see from your notes that you want to ask me about, and you start the conversation that way. So starting the conversation is a really good question, and you should make sure that you prepare various different scenarios and different ways for you to start the role play. Okay, so we have a question. What if the task on the task card and the verb is to give advice only, but then in the role play you give strong advice? Is that okay? So it depends on the situation and it depends on the reaction of the patient. So for example, if you are giving advice to a patient on medication, for example, then you may need to use strong advice phrases, in which case that's fine to use strong advice phrases, even if it says advise on the card. Or if you are perhaps talking about lifestyle changes and making suggestions, then you would use perhaps suggestions or advice phrases. So in short, the answer to your question is probably yes. If it says advise and you give strong advice, yes, that's okay, as long as you're reacting to the patient and responding to the patient in an appropriate way. Okay. Okay, and then another question is, do we need to ask the name of the patient during each conversation? So this is a good question. A top tip, during your preparation time, you can ask the interviewer what their name is so that you know their name before you start the conversation. Or you can say, in this conversation, I'd like to call you Tom, for example. So you can sort this out before your 5-minute roll card. Now, here is a difference between real life and OET life, because in real life, you would often start your conversation, depending on the situation. If it's a new patient, you might say, hello, my name is, can you tell me your name? If it's a known patient, then you wouldn't need to ask your patient's name because you would already know. So in OET, you can ask the interviewer that question, or you can agree what you're going to call the patient, or you perhaps don't need to use a name at all during OET role play. So that's another option. You can do the OET role play within the 5 minutes without using a name if you're worried. Okay. And we have time for one more question, which has come through in the chat. What if the condition on the task is totally unknown? So this is a good question, and it's something that might happen. So if it is totally unknown, it's important that you look at the information in brackets, as conditions and unknown conditions should be explained in there for you. So make sure you read the brackets. And then if it is totally unknown, try not to panic. And remember that the examiner and the assessors are listening for your ability to communicate. So try to deduce what kind of condition it is from the information on the roll card. And then if you're still not sure, just follow those steps for communicating clearly throughout the role play and making sure that you are meeting always the clinical communication criteria. Okay. Thank you for coming, everyone. It's been great to have you here today. Don't forget to register for our next free live lesson, which will be on Tuesday. The link will be in the chat for you now. If you loved our lesson today, please stay tuned to our social media channels, as we will be doing free live lessons every week. And you can find out more via our social media channels and what you've got coming up and when. If you are preparing for your OET, we have some great courses to help you. We have Reach OETB for nursing and medicine. So they're online courses which help you to understand the format of the OET exam, give you plenty of practice, but also help to expand your grammar and vocabulary that you need for the OET. We also have the OET Writing Correction Service. So if you are struggling with your writing, then you can, we will send you some case notes, and then we will send you feedback and correction on your OET letter. And we also have an OET practice test, which is really great if you've got your exam coming up and you want to practice your timing. If you would like to contact us, please don't hesitate to contact us on inquiries@specialistlanguagecourses.com or on our website, specialistlanguagecourses.com, which is in the chat box for you now. Thank you very much, everybody, and have a lovely day.